question was palpating. We find a spot that we think is interesting, but our partner goes, yeah, we put a needle in it anyways, and it is quite strong. Remember that intensity of experience for the person is defined not by the spot, but by how much chi is stuck in the spot. If blood is stuck in the spot without the chi, remember we talked about this yesterday, then they won't experience it as pain. If fluid is stuck there and there's not a lot of chi in there, they won't experience it with anything exciting. The only time it's exciting is if chi is stuck there. But by needling it and you bring chi in or you push the blood out, they go, oh, that's strong. They feel it. And then frequently there is this bubble of fluid, damp, we can call it, or blood, and there's a little bit of chi in the middle. But when I push, I'm never going to get to that little bit of chi because it's so packed in there. But then the needle goes in and ding, pew, it goes. So both of those circumstances happen. Depends on the diagnosis, but most importantly, remember when the person yelps, that tells you there was too much chi stuck there. And I want you to picture, it's a waterfall. And then we have a river, and then a river, and 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 a river. There's our mountain, okay? Now, here, there's a lot of pressure that hits. So it does this. And then some water goes down. And here, it picks up speed. Wow. And then here, it hits rocks. So it kind of goes, ping, 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 and then comes out slower. And then it comes along slowly, and here, it's very shallow. So this water comes here, it hits the shallow, so it backs up a little bit and goes over faster, and we get rapids. But the rapids are only there because it's shallow, not because the water is faster. You understand this, right? Okay? So then it continues, and then we have some logs, some beavers. In Deutsch? Beaver, like Justin. Good to know, right? You get the idea. So in a person, the chi is like this. It hits bones, and anywhere there's these bone spots, the chi is going to hit and move and then go. So therefore, there tends to be more chi. Therefore, it tends to be more exciting when we push it. Okay? But if I'm pushing on the other side of this, there's often no sensation or little sensation because most of the chi is stuck above it. So really, we're identifying where chi areas are intensive enough that we know if I needle into here, it's going to cause conversation along the line. But what happens if the person has cold legs, not much feeling? Then I'm trying to bring flow in. I'm not trying to communicate big. I'm trying to bring in. So the way to look at it is, this is the reality of chi and blood. What am I looking at in my patient? Where is it stuck? Where is it making a circle? Where is it getting shallow because it's crossing over a bone? Where is it running into logs and things and muscle knots and injuries from doing something? Where is it because they work on a computer all day, so now it's stuck up here? Those are all things I want to start to see. And if I can start seeing this in my patients of the flow, and then this afternoon after lunch, we talk about intensity of flow based on the constitution of the person, which is a big step to be thinking about.